Hey everybody, Dr. TomahawkCole here for LighthawkFPS. Today I'm going to be answering some questions from the Discord about health stuff. Let's do it to it. Spidey Womack asks, what are some good hand/wrist stretches or warm-ups? I jumped into training more than normal and the fatigue started giving me some muscle pain on the outside of my hand, I bet here, and wrist. I watched the video about wrist ergonomics, I do recommend that, to help a little, but was hoping for some stretches to go along with it. So here's the thing about pain and trying to stretch it away. Most of the time, if you have pain somewhere that's new and acute, you won't be able to do anything about it. You won't be able to, there's like no magic health potion we can use to heal wounds that occur. When something hurts, if it's an acute injury, like you stepped up your training, so you ended up damaging yourself a little bit, you can't just stretch it or exercise it away most of the time. But there are caveats to that. When I say when you get an acute injury, so let's say you step up your wrist use by training, let's say 4 hours a day, all of a sudden, and you start feeling pain. Somehow you manage to get that pain by using your wrists in a way that it wasn't used to, and maybe in a way that isn't ergonomically sound. So maybe you're holding your hand in a lot of ulnar deviation when you're playing and you don't even notice. Or maybe you're really using your wrist and you're really cranking it all the way over into ulnar deviation because you're really going to end range really hard and a lot. And that could be causing your problems. Or it could really be that there's a muscular thing going on. On the outside, it's less likely to have a muscular or tendinous pain. Let's see if we can pull up some other pictures here. Right. So this is the carpal bones. Let's go back to here and look up tendons. Here we go. So over here you can see we've got all these tendons coming. There's a sheath here. Sometimes when you have pain and it's muscular or tendinous, the thing to fix it is actually exercising it. We're going to talk about that in a couple questions. But where you're saying the pain is, you can see on this, there's not a lot of stuff that connects right there. There's musculature that cranks your hand this way, right? But the thing that usually ends up hurting here is the TFCC, or structures associated with it. TFCC, triangular fibrocartilaginous complex. The big thing to do when you have pain somewhere here is do everything you can to not let that pain keep happening. That's the biggest thing you can do. So avoid any recurrent pain. If it hurts to do something, stop. This might mean you need to stop training for a couple days or change your training to make sure you're not using ulnar deviation at all. Recently in jiu-jitsu class, I was wrestling with someone who was 380 pounds and I slightly tweaked my wrist here, just holding up like this. And now, because I was also training a whole bunch, using my hand for a whole bunch of stuff, it's hurting still. So yesterday I took the day off of aim training. Today I'm going to make sure to take it easy. Typing hurts unless I can get the angle right. So those are the types of activity modifications you need to do if you want to help your hand feel better. Playing through the pain in that case is not the way to go. There's a long answer to that question. Take it easier. Wrist stretches and wrist exercises are important though. So let's touch on those anyway, even though I don't think that's gonna fix your problem. SS Ninja asks, for people that had or have disabilities like arthritis, RSI, which is repetitive stress or strain injury, etc., affecting their aim or comfort, what sensitivities should they be leaning towards? So what sensitivities should they be leaning towards is a question, but of course I don't want to answer the question. I want to answer the underlying reason for the question, which is what should people with disabilities do? different states of different things going on. We have a picture of someone with rheumatoid arthritis, an actual like disease that there's not a lot you can do about. That isn't caused by something you did, but it's caused by an autoimmune disorder. So this is just a good picture of someone with messed up joints. But to answer the question, what do people with disabilities do? So one of the biggest things that I've learned being a physical therapist is things like that people view as an unmovable, unassailable, unchangeable thing about themselves, like arthritis, have actually probably been I want to say misled, but it's more like people just believe that, oh, this is the end. My joint hurts. It's always going to hurt. The doctor told me I have arthritis. There's tons of studies though, where they look at MRIs of people or X-rays of people, and they look at their joints and they see if they have pain. Tons and tons of people have joints that look like they should be arthritic, and they don't have any pain at all. Tons of people have joints that look normal, and they do have pain in their joint. So why are we thinking that these joint changes are actually causing the pain? It's even though it's just correlated sometimes, but the correlation is weak. So one of the biggest things I've learned, like I said, while working with patients, is that if you have decreased range of motion, which is often what presents with something like arthritis, your pain isn't due to the joint changes that you see. The joint changes are secondary to that reduced range of motion. So if someone says you have arthritis in your hands because your joint hurts, I can tell you both my thumb joints had hurt for years until I started stretching them. So if someone tells you that, it's just still, it's like an old timey, we've been thinking this for 300 years and the science hasn't caught up to every doctor's knowledge yet. It's like, oh, you have arthritis and that's just how you are. Now, the picture that I have up here of rheumatoid arthritis is actually of like an autoimmune disease that goes in and destroys your joints. That's a real arthritis. But most arthritises are just tight joints that hurt. And the way I did it again without trying. The way tight joints work is every joint is surrounded by connective tissue that holds everything together, ligaments, and then additional layers of joint capsule around the joint. So it's just a bunch of connective tissue, white stuff, holding it all together. When a joint isn't moved through its full range of motion, that tissue around the joint begins toint. Hassan says, toint is my new word for tight joints. When that connective tissue is around a joint and it doesn't get moved, that joint doesn't get moved through its full range of motion, the connective tissue starts to get tight. It starts to not be able to move through that full range of motion. And then when you move it into a range of motion that it's no longer able to go into, it stretches. And it stretches, and that stretch has a receptor in it that says pain, and that causes pain. So imagine the easiest thing for me to think of for arthritis, to give an example of, is people's knees. So I've seen a ton of older people with knee pain, and it started a long time ago and has slowly gotten worse. What happens if a joint is really tight, like your knee, and then you take a step, you've been avoiding range of motion, you take a step and it forces it. Now that really tight tissue, instead of stretching because it's so tight, it just rips. And now you have like an acute little injury there. It's not that bad of an injury, but it is going to hurt and swell up. So this reduced range of motion ends up being the real reason for all these problems. So if your hands are hurting, if you have a joint that hurts to move through its full range of motion, like if I bend my thumb down to here, if I bend it and push it and it hurts, like which mine used to for years, and it would kind of ache on and off before I became a physical therapist. That's how you know that the connective tissue is the issue, because when you do it, ow, and then you let go, the stretch stops and the pain stops. Eligard in the chat says, stretch the body through its entire range of motion daily. Yes. So I do that to myself every day now. I have a stretching routine that I go through every single day for pretty much every joint. And it's the only thing that ended up making my back feel better. Send routine. I'm going to make a video about it one of these days. For sure. Because it's important. The thing is, though, one of the things I don't stretch for myself is my shoulders. Because I've always had extremely mobile shoulders. And I've had a labral tear on this side, and when I stretch this side too much, then it re-tears. But stretching my hands, I do. Stretching my thumbs, I do. Neck, everything. The question was, and Hassan says, I need to get back to stretching my hands and arms. It's so easy to fall off, even as a physical therapist. Well, it's hard to do it, even though it only takes like 15 minutes to go through everything. But the question was, for people that have disabilities like arthritis, not a disability. That's something that can be fixed with physical therapy. Unless you've had it for like so many years that there are actual tons of joint changes. But anyway, most of the time, unless you're really old and you've had it for like 20 years, you can that I fixed in even very old people. Repetitive stress injury is not a disability. Repetitive stress injury is you're doing something wrong and too much, and potentially the muscles aren't getting the stimulation they need through normal exercise. And that can also be fixed with physical therapy. They have those things affecting their aim or comfort. What sensitivities should they be leaning toward? They shouldn't be leaning towards a sensitivity, because when you lean towards a sensitivity and reduce your range of motion further, the problems will get worse. Because now the tight joint becomes tighter. This is why you see people getting knee replacements, because they get tighter and tighter and tighter and tighter. Hurts more, they move it less. Hurts more, they move it less. Vicious cycle until they can't move it anymore. When you don't move, the joints don't get the nourishment that they require, because joints only get nourishment through movement. They're like spongy. They don't have blood flow like everything else. They have like a sponge mechanism that only works when you're moving. So lo and behold, you don't move the joint, your joint just dies. Now, if you had something like rheumatoid arthritis, which is an autoimmune disease, then moving your joints during what's called a flare-up, when there's actually like an active autoimmune attack on your joints, from the research I've seen, like you want to avoid doing anything to make that worse. So don't play if you're having an RA attack. But most people don't get RA until they're older, and it's mostly a disease that affects women. So maybe in 20 years here, we'll see more older women gamers who have RA. But in that case, it would be like, if it hurts, don't do it. And that's the biggest thing. If it hurts, don't do it. Let it heal. Having randomized sense better than randomized sensitivity is a whole different discussion. Sensitivities that you should be leaning toward, probably it's going to be whatever doesn't hurt. But the big thing is going to be fix the problem, don't avoid it. How's that for an answer? Fix the problem. Okay. Next question. Next question. Sensitivity isn't the answer. Unless you really, you'd have to look at each thing. Like I said, RA is something you can't avoid. So if it's easier for you to move in a small area with just your wrist and your fingers, then you'd want a high sensitivity and you'd want to practice that. Now here's one. Noted, Eligard says. Now here's one that I've experienced, and I know Delight has experienced. So Delight is the aim coach over at LighthawkFPS. So this has happened a lot to me with a lot of clicking on like static drills. You click, 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 click. Just become ins 404, dude. I do not know who that is. But I hope it's okay. I'm assuming they don't have fingers. He only uses arms and wrists to aim. Oh, there you go. Don't need fingers. Okay, so here's this question. Is there anything you recommend for pain above the right knuckle on the index finger, specifically after long sessions? Yes. This one I have solved for myself and Delight, and I'll tell you the reason why it hurts first. Oh, look at this, guys. Why are you spinning? Whatever. Looks cool. Okay, so your index finger. See this pink muscle right here? Your index finger has its own extensor muscle. It uses the other ones too, but it has its own extensor muscle, right? So it's different from your other fingers in that it has that. It has its own muscle named for it. The other ones, they have like muscles that come up and whoop, they go to all your fingers. That's why it's hard to like have one bent and the other one's extended, because they kind of connect and mesh in the back of your hand. But this extensor muscle, I just needed a picture about it. What's really happening here is we're using our fingers when we click like this. When we click over and 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 over again, we're using our index finger in a really weird and unnatural way. We did not evolve to barely move our finger with like a tiny bit of force over and over and over again in a very small range of motion. It's super weird. And then to do it like 10,000 times in a training session or more is going to put some stresses on it that it doesn't usually get. It's not evolved to do that. So what happens is, most likely, we don't know for sure, but most likely there's some damage that occurs here at this joint. Very low level, but it adds up when you do it a bajillion times. Eligard says, "Oh Lord, the finger." Eligard says, "The finger." Oh Lord, what's happening? Oh Lord, ah! No! Get out of the way, picture! Let's try that again. Get out of the way, finger. Picture. Dang, what? It didn't work. No. Okay, that one worked. Okay, so what happens is there's some small level of damage to the finger, to the joint there, probably. And that, when you just do it more, you just ignore it. So the reason that there's damage there is because that motion is so little and so insignificant that your body most likely doesn't even know that something has happened there. Like it doesn't know that it has to go increase blood flow and send in some white blood cells and send in growth factors to start like a healing or a reinforcement process. Like how you get calluses on your hands. Cartilage in runners' knees is thicker. It's the same thing. Your body responds to the stresses you put on it. This stress is abnormal and small and super repetitive, and it's not interrupted by anything else. So what happens is there's not an appropriate response by your body. Now, the solution to that then is to stimulate that appropriate response. And as a physical therapist, it was easy to figure out what that appropriate response is. Hassan says, "Oh, so by purposely putting that stress on it, you trigger that response." Exactly. So a lot of times when you have something like tennis elbow is a great example. That muscle isn't being used through its full range of motion. It's being used as a stabilizer in tennis or whatever you're doing with your arm that gives you tennis elbow. But it's using it as a stabilizer instead of that. So parts of the muscle aren't releasing like growth factors that help with healing and adaptation. So what we want to do is stimulate that. And I've got some of these like foam blocks here for like hand therapy. What's the hardest one? I think is the blue one. Feels harder. So there's a lot of different ways you could do an exercise. To help with this. But my favorite one is taking it. Get out of here, game. Get out of here, picture. My favorite one is taking it and doing the clicking motion, but hard. So you don't need a foam block, and actually I've tried it with the foam block and without, and I find a better response to this if I use the table. I'll use my hand here because you can't see the table. But so what I'm doing is I'm pushing hard with my finger and I'm moving my hand through the range. So I'm going like as far back as I can, basically, to as far down as there. You can go further with this, but then the leverage is different and you need to do a different stuff. There's different muscles that connect. One connects to the middle and one connects to the end. That if you cut your finger here, you can lose the ability to bend your finger at the end. So there's one that connects here and one that connects at the end. But we're stretching, we're using both of them when we do this. So the exercise for this is 3 sets of as many of these until like that muscle feels tired, to fatigue, and past it a little bit. That's the exercise. So I'm just pushing down. You could also do this. It might also work, I haven't tried it, to do a less specific exercise and do like a grip training. Like just squeezing. But I like this specific one because it definitely works. Fix you right up, easy. Another one, time to learn human anatomy, Yellow Guard says. Another part of that is, or another thing you can do that feels good, but I don't think it would actually fix the problem, is give that joint some other stimulation and get it through a full range of motion and give it some extension. So I take the finger. If I straighten my elbow, I'm going to stretch the muscle that comes all the way down and under. If I do this, it doesn't stretch the muscle. Still stretches the joint, still feels good. 30 times. But the big one, the most important one, isn't the stretch. It's going to be the exercise. I'll do a video on that one of these days as well. I'm going to do like longer videos where I do some more production into these. But for now, that's the answer. That's the answer. Where did my mouse go? There it is. Okay. Next up. But by doing that, and I stopped doing that because I stopped doing so many static stuff because I don't have time to do every exercise in the world. Come on. Come on. We had a question about a corn on the side of your hand. So we had a question about a corn on the right side of one of the people in the Discord's thumb. They had asked if there's a way to prevent it from worsening. So corn is basically like a callus. If I understand correctly, I am a physical therapist and not a medical doctor. So like corns, I feel like the only thing I learned about corns was like patting around them in school. But the biggest thing about them is it's like a friction thing. It's like a built-up callus. But you'd have to ask your doctor about getting it removed. Okay, next question was good too. I really like this one because can you do plastic surgery to remove your nipples? Uva Jack says, I hope so. You know what, Big Spooky? I'm sure you absolutely can. The next question. After using claw for a little while, my pinky aches a little. Is this a grip problem or is it a mouse problem? I use a Logitech G703, but ordering a super light. Will the use of an ambidextrous mouse fix my problem? Not the only reason why I want a Superlight. Superlight's really good. I like this mouse a lot. Okay. Very good question. And one that I've actually talked about with the light before, but not because of pain, just because we were talking about grips. Let's look at a grip. That is not the way to switch. This is the way to switch. Okay, I got it ready. Boom, boom. Where is it? Here it is. Okay, here is like a pretty much claw grip. But this is what's most likely happening with the pinky. Let's zoom in. Enhance. Enhance. Okay, we enhanced. Okay, you type in claw grip and all you'll see is the index finger side. You'll never see the pinky side. But if your hand's like that, it's probably going to look at least something like that, sometimes curled even more. So what happens? Big Spooky in the chat says, that does not look good. So what happens is, if you're curling like this, and you're putting a lot of leverage here, you're putting these joints in like a more intense position, and then leveraging them sideways. So if I'm like straight here, I can put more pressure like on the side of my pinky, and then like the leverage on my whole pinky is very low, right? I'm holding on to it. If I'm like this, now this middle joint is like fully leveraged. This little joint down here is fully leveraged. Like they have to like really crank in rotation. So there's a lot more force going through them. That's fine. It's fine to have a lot of force going through your joints, even at angles, as long as it doesn't hurt and as long as you get out of it for long enough to prevent that just like a constant strain on it. So over time, if you do this, your joints, like if we were to dissect you and look at your pinky joint would have like thicker connections on those sides that are being leveraged. Right? Like the tissue that's being stretched should have a thicker connection. But if you do it all at once and you do it for 8 hours, once again, we run into that like abnormal stress zone where your body is unable to create the same like growth factors and like immune response that you need to heal problems. But what is being described by this question, boing, is that it hurts. So what's happening is these joints that aren't used to it are getting stretched and they're hurting. That's what you see. You see stress on the joints. So if you want to modify it so there's less stress on your joints, that might help. So maybe turn your hand a little more. I don't know. It would be a very personal thing. When I grab like this. So I'm using like multiple fingers. I've got the 2 up there. But I use fingertip grip. So the answer to this question is, it's your grip. See if you can put less pressure on your pinky. If it keeps hurting, you don't want to ignore it because that's how problems will come. If you keep building up, then you start to get a problem. So if it hurts, don't do it. You can try stretching. You can try 30 times in whatever way you're stretching. You can try a grip strengthener like these foam blocks for your pinky. That might help if it's actually a tendon problem, but it's hard to say for sure. Most likely though, it's just the ergonomics of having leverage on your pinky forever. Thank you. Work is fantastic. I really like how you explain the concepts and confirm some of them work because I'd already tried them on me before. Keep great work. Keep up the great work. Thank you very much, Francibald. I like that for a question. Yeah, so I'm not going to present things here that don't have a basis in either like studies, which is my biggest thing, or a lot of anecdotal evidence, which you should always be careful of, even from me. But Unless I really think it fits like the mold of what's real and what's working, and I've tested it a bunch of times. But always believe studies more than someone's anecdotal evidence. Yes, but thank you for that nice comment. I think, do we have any more? Oh, we have Eligard asked a question here. Let's answer Eligard's question. I think this is, oh, and then Hassan has a question too. Oh, okay, but we'll get there. Let's see, there we go. Dr. TomahawkCole, PT DPT says, I'll go through and answer all these on my stream tomorrow. Oh, no. What are things to look out for in terms of grip / tension to prevent finger pain / soreness when gaming? Okay, this one I like this question a lot because you'd think it would be like a really obvious answer, but it's not for most people. It's normal in like every activity that a human does when they're trying really hard to do something. And it makes sense evolutionarily in a lot of different ways to like put more effort in. Like, what if I wanted to move this tree? That I have to try as hard as I can. I'm trying really hard to do something. Or if I'm trying to sprint after something, I want to try as hard as I can and activate all the muscles that I can. In reality, there's a lot of efficiency that you get sprinting by practicing. But, you know, when we're first learning things, this super grip in our mouse is attempting to like stabilize everything and then also like move it very quickly. And we're just trying so hard to do it. And as you've seen in my deliberate practice video, when you do something over and over again, like that's gonna turn into your default. And you're not going to be able to unconsciously overcome that default. It's just going to happen. But the reason I brought up these muscle fibers is because the way your body moves with your muscles is it sends a neural impulse down to your muscles. On this case, it would be this side. To do this, right? Or to your other muscles in your shoulder to move. So it sends a neural impulse. But when it sends that impulse, it sends an impulse to turn on a certain number of muscle fibers to make the move happen. So we don't have like an analog system inside our brain and inside our muscles that's like, okay, we'll do 22.1%. We have, when it comes down to it, these muscle fiber units here. There it is. We have these muscle fiber units. And here's the nerve, the sarcoplasmic reticulum comes in. That's how they end up getting turned on. So what happens is we have like a digital, an on or off switch for tons and tons of these guys. So our brain has to modulate the number that turns on. When we're really gripping everything, we're turning on a whole bunch of extra stuff everywhere instead of just turning on the exact number that we need. And then we're turning too many on here, so we have to counteract it with too many on the other side. And that's what that stiffness is. You're trying to stabilize instead of just turning on the right amount and getting there. There's always going to be some kind of stabilization, but you're being really, really inefficient with your movement when you're being really stiff. Now, if this mouse weighed 20 pounds, then you would need more. Then you would need more force, right? You need more muscle. But this thing weighs like nothing. The weight of your hand and your arm is way higher than the weight of the mouse, even if you have a really heavy mouse. So what you're doing, Eligard says, stabilize instead of optimize. Exactly. And it's easier for your brain to stick to do the same thing. I say this all the time. And we had someone in the Discord last night who might have been a troll, or it might have just been someone who's really down on themselves. But they're like, I can't get better. If you think you can't get better, you won't get better because you won't practice. Because the biggest motivator, the biggest challenge to getting better is putting in the work. And if you have no reason to put in the work, you're not going to put in the work. But you're being inefficient with your movement when you're being really tight. And the only way to fix it is to practice being relaxed. Now, don't expect, whenever you practice something new, expect a drop in score because you're learning a new thing. But you need to explore these areas in order to keep improving. If you don't explore them, you'll just sit there in an automated process where nothing changes and no new connections are made. Does that make sense? Oh, a really good example of this is people on a slack line who are bad. So, does everybody know what slack line is? Slack line? Slack line fails. Shut up. We don't need the volume. Shut up. Okay. Okay, these guys are actually doing a pretty good job. You're forced. That, you see, if you're new, if you ever gotten on one of these, I've gotten on once, but that's what ends up happening. You end up, whoa, 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 whoa. Because what you're doing is you're overcompensating, and then you're overcompensating, and you're overcompensating, and you're overcompensating, and you're overcompensating. These guys are all like people who are really good at slacklining, so it's not a great example. But when you start overcompensating like that versus someone who's really good at it, who just stays completely still, that's the difference between being really tight with your mouse and having a really super hard grip on it and having a nice relaxed grip where you do exactly the amount of force to get the job done. In the case of a slackline, if you don't do that, you fall off right away. Like, see, he's doing a good job. And now he's dead. So, Hassan says, that's why I love sense randomizer so much. You're forced out of your comfort zone. Yes. Yes, and we're definitely going to talk about the sense randomizer at some point. I don't want to talk about it too much now, but I used it for like 2 weeks always, and it was interesting. It was interesting. Okay, there's that question. Done. Another question. Down. Thank you. No, thank you. No. Thank you. Next question. I gotta fix that black screen at the end of that one. Where am I? Okay, we're here. We're here. Now. Boom. Boom. Hassan in the chat asks, I get pain in this joint after long sessions with my mouse. Any remedies? I fingertip if that matters, and my grip is extremely loose. Okay, this is good because it's actually different. Broccoloni Lamau. Hello, Broccoloni. Guys, I got so many of these. I got so many of these little things. Anyway, so this joint right here, the last joint of the finger, the distal interphalangeal joint. Of the fifth finger. Okay. So my question would be, if you have pain here and there's not like an abnormal force on it, which if you're using fingertip and your grip is loose, there shouldn't be, then what is wrong with that joint? That's where I go for physical therapy. So what is wrong with this joint here? If it's painful after a long time and you're not putting these stresses on it, it most likely means that the joint itself has something wrong with it, maybe. And that's not, and the thing that I talked about earlier with arthritis is, the thing that's probably wrong with it is it's probably, my first guess would be it has reduced range of motion. So if you were to take it and stretch it like this all the way, it shouldn't hurt. If you take it and you stretch it back all the way, it shouldn't hurt. If it does, if you have a joint like that that hurts, a lot of times with my patients, that's when I know it's time to stretch. and we do the 30 stretches. I've had that problem. I had that problem in my elbows, both of them, for many, many years. And then I became a physical therapist, and then a year went by and I figured it out. I have more wrist pains than anything. Meezy, the next physical therapy video that I should be shooting today will go over keyboard placement, because you said it was your keyboard side before, right? So we're going to go over keyboard placement. Pushing it outward doesn't hurt, but pushing it in hurts. And it certainly feels different from my left hand pinky. So it could be that tightness, if someone says what you just said, it could be that tightness is from an old injury, because let's go back to this view. And it could be even like an innocuous injury that you don't even notice, like you hurt your pinky one time and you just never stretched it. So if I had pain there, I would do this stretch into the pain 30 times, at least twice a day. But a really good example of joints responding to injury is one I gave myself because I didn't know the knife I was using, the sheath I was using wasn't closed off because I didn't check it. My bad, but not as bad as if I hadn't checked it. So you can see kind of right here, there's a scar. And there's actually a scar that goes all the way from here to there and then there to there, where I slashed my fingers super deep and cut through the nerve and the artery there and the vein. Bloop, right on the edge. So right here has reduced sensation because I cut the nerve like 2 years ago. Whatever. Shouldn't have done it, but I learned a valuable lesson. Check your equipment. But I didn't do anything to these joints. I didn't smash them. They didn't get damaged. This joint and this joint. This joint didn't get damaged. It was so far away. But the inflammation from this injury caused my fingers to like freeze up super tight. And after it was healed, the joints were tight for months as I had to stretch them. And even now, this tip of this finger is still painful. Somewhat. I mean, it could also be from ripping it around in martial arts classes. But it took a long time and a lot of stretching, and that's what people who aren't physical therapists don't know that they need to do. So this joint was cut. The joint itself wasn't cut, but around it was cut. The inflammation caused the joint to seize up because those inflammatory, that inflammation in your body tells everything to like tighten up and like, I'm hurt. Let me heal. Don't move me. So if I hadn't stretched this out aggressively and it hurt really bad to stretch it out, then I would still have pain there 100%. And it's been 2 years. So I would bet, and I've done my 30 reps, do it again before bed, Hassan says. So I would bet that stretch for that will do the trick. If I had a patient, that's what I would tell them. If I had myself, that's what I tell them. Usually if that's the case, when you do 30 of these and you go into it, you're like, oh, it already feels better. Like most of the time it'll feel better right away. It sounds like it doesn't hurt unless it's been a long time. But I had the same thing with my thumbs from hitting a punching bag and hyper flexing them and then never stretching them. And now I stretch them every day. Every day, it keeps them feeling good. Okay. Do we have any more questions? We have Meezy's question. We have no more questions here. We did it, guys. We freaking did it. Yes. Okay, so Meezy's asked me before about when I did my wrist ergonomics video. It was all about the mouse, because that's really probably most people's problem will be wrist pain with the mouse because it's moving a lot more. But you can definitely get wrist pain with your keyboard side too. So let's go over that real quick. My next video is going to go over it also, and I'll have a little bit more production value there. But let's get a picture of a keyboard up here. Keyboard placement. Here's a good picture that I think is probably I don't agree with. Perfect. For gaming, it is wrong. It's just wrong, guys. Okay. Get in here. Okay. Come on in, guys. Come on in. Okay. So here's... Shut up, lady. Get out of here. I just want your picture. Where's a picture of a wrist? God, even that's wrong. Even this is wrong. Okay, so what you will notice here, I'm just going to talk about this here. Oh, come on, Google. Google. Work with me here, Google. Okay, good enough. So what you notice here is arms are in like this, right? Normally we don't play with our mouse kind of in like this. Like, and just like super in with that ulnar deviation to the outside with that bend out. But they want the keyboard to be like that. Because when you type on a keyboard and the keyboard's close together, you have to do that, right? If you're using two hands on a keyboard, one of your hands is going to be ulnarly deviated. Deviated to the outside, bent to the outside. So, if your keyboard is straight in front of you, if your keyboard is straight in front of you, and your arm's like this, look at my wrist. If I'm coming in from the side, you see how my wrist is bent way to the side? That's gonna hurt over time if I leave it there. My wrist is bent to the side. Hard to see. So, I turn my chair when I type. There you go. But if we're talking about, like when you're typing, it's, you know, you gotta do what you gotta do. You're gonna have to bring your elbows in as much as you can to type. But when you're gaming, you only need one hand on the keyboard. So what I do is I end up turning my elbows out a little bit. My wrist is straight, and I put the keyboard there. So I'm not doing this. My keyboard's actually turned so that my wrist can stay straight. I want to keep my wrist in the least cranked position possible. This picture right here shows a nice ulnar deviation crank to the side. Arms coming in. That will hurt. The way to tell if that's your problem is if it hurts on the outside of your wrist when you're doing that. Theoretically, I guess you could also be doing a radial deviation, but I doubt it. I doubt it would ever happen. So I'm here, and what my keyboard looks like is it's not quite straight on with me. It's a little tilted out, actually, which you think would be more ulnar deviation, but it's also way to the side. So my monitor's in the middle, my keyboard's here, my mouse is here. So when I come down, I'm kind of evenly distributed. All those CSGO. So I've seen the people who put their keyboards and their mice inside like this. That's also fine as long as your wrists are straight and their wrists are straight. Yeah, some of them have their keyboards turned fully degrees. That's fine as long as your wrists are straight. Now what's happening is your shoulders are really internally rotated, and that's perfectly fine. Your shoulders are like built to move through a huge range and just kind of sit around, not forever, but, and they might have some problems in their shoulders, but if it doesn't hurt and they do other stuff, then they're fine. But yeah, this is totally fine. My wrist sits on an incline. Does it hurt? So these wrists, my keyboard won't come up. But I have, this isn't my real keyboard. This is the streaming computer keyboard. But I have the thing on mine so that I can try to rest it as, and it, I guess it only rests for my thumb really anyway, because my hands are so big. But I kind of just rest it, try to keep it as neutral as possible, and then go from there. With my outside of this wrist being hurt from jujitsu, I've noticed when I type, I really have to ulnar deviate with this right side because of the way I have my keyboard turned. So over the past few days, whenever I go do it, like, ow. So now I'm trying to type with just keeping it straight on from the side. So I have to like type weird with my hand like almost like 70 degrees off the keyboard. What is your favorite submission? I love arm bars. I am best at arm bars and I love arm bars. I can always snatch an arm bar. I ordered a wrist rest, but I'm waiting on it. Whatever you can do to make it stop hurting. If your wrist is like really high like this, that's going to hurt eventually. If your wrist is low, that's going to hurt eventually. If you're somewhere in here, it might not be your ergonomics. It might be that you've had some tightness in your wrist at some point due to an injury or just from lack of moving it. And you could do those wrist stretches we talked about at the start where you do flexion 30 times and extension 30 times. Your wrist was previously injured? Yes. So most people, when they have a previous injury and they haven't actively gone to physical therapy or stretched it, then you will most likely feel better, with a more neutral position. But it's dangerous because if you never move out of that neutral position, your wrist will get worse with time as it tightens up worse and worse and worse until like you're 60 years old and you're like, well, that time I hurt my wrist 50 years ago, man, that's really killing me now. When really it wasn't the initial injury, it was the lack of range of motion throughout 50 years. So I would recommend to anyone who has restricted range of motion, I recommend, and restricted range of motion usually means pain, to increase their range of motion, unless it's something like with an instability. Like sometimes you can have a vertebrae like break off, a spondylolisthesis is what that's called, and be careful with that. But or like a shoulder dislocation, you don't want to push range of motion and external rotation of the shoulder with that, or a labral tear, you want to watch out for range of motion with that. I know that from experience. You want to watch out for internal rotation in my case. But for something like simple joints, especially like wrists, fingers, they only go in one direction, knees, toes, ankles, restricted range of motion is a killer. And the natural progression of it, because we're not forced to do things in that range of motion in our daily lives, is it will get worse and worse the more you baby it. But also if you just go crazy on it and like jump on it, that'll make it worse too, because it'll rip things instead of stretch them. Gotta stretch them good. Okay. That's it for questions today. I've been TomahawkCole, Dr. TomahawkCole for LighthawkFPS. If you liked this video, please like and subscribe if you're watching it on YouTube. Everyone who watched it live, go like and comment on every video on the YouTube. The LighthawkFPS YouTube. Thank you for your answers. Thank you for asking questions. Please ask more questions. The LighthawkFPS Discord.
Minigames targets go through a deceleration.
Good wrist posture isn't going to be exactly the same.